Good evening, everyone, and welcome to another episode of This is Revolution Podcast. I am your host, Jason Miles, and if you are new to the show, please hit the like button, hit the subscribe and the bell so you are notified every time we go live, as we are constantly adding new programming to the channel. And I want you guys to be alerted whenever we go live. I am reading the comments on the side of the screen, and someone says that song is very Oakland. Thank you. Being from the Bay Area, I appreciate that. Without any further ado, let me bring in my homie, my co-host, my dog. He is the man of the Mau Mau Hour. He is the Pascal Robert.
Peace and greetings to the chat. Peace and greetings to the audience. Peace and greetings, Jason Miles.
What up, man? How are you? Gotta get that extra one. How was your MLK?
I'm in a very good mood.
You're in a very good mood? Good.
I really am. Enjoy it.
This is a very depressing topic, so I'm glad you're in a good mood.
Enjoy it while it lasts.
Are you going to smile?
I smile all the time on the show. I don't know this notion where I don't smile where this comes from.
Well,
I don't stay in a smiley posture, but I smile on the show. I joke and I laugh on the show all the time.
I think you do it behind a paywall so most of the viewing public doesn't see it.
Whatever.
You know it's true. Did you watch the intro clip for the show?
I did watch the intro clip. I thought it was very spicy that you had people realizing that there was a thing called AIDS when I was in high school or elementary school that was a exercise candy that actually was coming out in popularity at the same time millions of people were dying of a disease called the same thing.
I remember that commercial actually as a young person. Because it used to come on one of the channels. If you're from the Bay Area, it used to come on channel 44 all the time during Voltron. And I literally found it on accident. I was actually looking for the Trapper John clip that I put in there. Do you remember Trapper John MD?
Of course, Trapper John MD, former character from MASH, who eventually gets his own series as a senior citizen. I used to watch that show. I was a big MASH fan. Kind of nerdy, yes, I know.
Well, let's watch the intro clip before we bring in our very esteemed guests.
For sure.
Overweight was terrible. The AIDS helped me lose 46 pounds. The AIDS diet plan helps 28 pounds.
AIDS helps control your appetite so you lose weight. Yet AIDS lets you taste, chew, and enjoy. And the appetite suppressant in AIDS is not a stimulant.
While the nation falls deeper into a state of COVID apathy, yet another variant rears its highly infectious head to spread the virus for what could be another wave of lockdowns. With trust in institutions at an all-time low and vaccines and mask wearing becoming even more partisan, will we ever see our way out of this pandemic? With both major political parties captured by big pharma and the healthcare industry, how can we forge a pathway to Medicare for all? Could the proposed measure for single payer in California be a catalyst for the rest of the nation? We'll ask these questions and more. This is Revolution.
Oh, smell it, young fella.
You don't know how to hold a baby. Please, here, let me in. I got one just this age. It is.
Should have got you brownie.
Where's the baby?
There.
Where's his mother?
Mother? Gee, I don't really know right now.
Honey, you've got to get a hold of her right away.
I think she's out of town. It's impossible. Why?
You'd better find her, or we're going to have an epidemic on our hands.
Epidemic? What are you talking about? What's wrong with him?
I don't know how it happened, but the kid's got pneumonic plague.
Plague?
Thank you for watching. Please don't forget to hit like and subscribe. So there you go. There
Well,
is
all right.
an intro clip to get you guys ready for the show today. Someone says that's Scott Bakula in the tux. That was not Scott Bakula in the tux. And yes, there is a commercial that says try peanut butter AIDS. That was an oopsie of marketing if I've ever seen one. But that episode of Trapper John MD is called Quarantine, and it is literally about trying to stop a pandemic by quarantining people who didn't want to be quarantined. And if you remember that show, it was one of those shows where situations would happen in the hospital that never happen in a hospital. Unless our doctors who have been doctoring for some time can tell us otherwise, maybe this is a more common occurrence than we think. But the bride at a wedding had gotten injured, so the entire wedding party was in the hospital. The Trapper John's ex-wife had found a baby and just took it. She didn't tell the police or anything. She's like, I found a baby, it's mine now. And the baby ended up having the plague and was infecting people with the plague. And man, oh man, did they have some horrible quarantine measures, considering the hospital was filled with PPE. So let's bring in a returning guest. He is our favorite doctor. He's our Trapper John and Quincy all rolled into one. He is the Dr. Eric Osgood.
What's up, guys? Good to be back.
Well, all right, Dr. O.
We're glad to have you coming off of your superstar appearance on Dr. Drew.
Yeah, that was interesting.
I keep wanting to say you were on Love Lines, but you were not on.
Yeah, that would have been cool.
You were on. Don't tell me. You weren't on the one where all the famous dope things were in a house. You were in another one.
The Surreal Life, yeah.
was it
Surreal Life or was it Celebrity Rehab? Yeah, that was him.
Celebrity Rehab. That was his.
He was treated. He treated the guy from Alice in Chains and like so many other people that unfortunately.
Steven Adler from
Bonaducci.
Danny Bonaducci, yeah.
Oh no! Wait, no. That was that him or was he on the other?
He was on one of those shows, but I swear it was.
I don't think he was on a rehab one. I don't want to commit, libel, or slander on Bonaducci.
on the great Danny.
On the great DB.
And let's bring in the special guest who is in the corner of the screen, as you can see. She is the Dr. Victoria Dooley. Esteemed.
Good evening, fellow kids.
Good evening and welcome. Thank you for agreeing to come on this show. From the first time we had Dr. Osgood on here, he mentioned your name and said we should try to get you on. I was like, she might not return my email. If you can reach out, I would appreciate it. So Eric did, and you agreed to come on, so we are very excited to have you on the show.
Very much so.
Let me start off with the first question. COVID's been going on for a while now. I think a lot of people thought it was going to be a few months and we could get back to shopping and doing all the other things that we like doing in this country. And for the most part, a lot of places are still under lockdown. I live in Mexico now. It's actually it's more strict here than it was when I was in California, as far as like mask guidelines and temperature checks and all that good stuff. But I live in a bit of a smaller town, and our numbers for COVID are pretty low. And you cannot leave the country if you're a Mexican national to go to the U.S. without getting vaccinated. So the numbers are pretty decent where I am. But in going back home to California, I felt that people were it was a mixed bag, unlike I had ever seen, especially when it comes down to this new Omicron variant. What
Yes.
what are you guys seeing? Because you guys are both doctors practicing with Omicron. I'm reading mostly LA Times, and I'm seeing that hospitals are starting to get filled up again in California. In your respective states, what are the numbers looking like as far as hospitalization? And I'll start with Dr. Dooley.
Well, Michigan is horrible. We've been bad for quite some time now. And it's interesting that you mentioned Mexico, where you are. I was in Mexico in December visiting some family members, and we were in central Mexico. It wasn't maybe like 2 hours from Mexico City.
Okay.
And we went to a mall, and it was just, you had to do a temperature check before you entered into the mall and entered into each individual store.
Mhm.
It was 100% mask compliance. So there was armed guards going around, and there was a free COVID shot. They were doing free COVID shots right there in the mall. So compared to my home mall in a suburb of Metro Detroit, where, it's kind of hit and go, hit and miss. I haven't seen them recently doing any COVID vaccines at the mall. And, just whoever wears their mask is whoever wears their mask. So I was really impressed, and I felt safer there than when I came back here, and especially doing something like going to the mall. But Michigan has been bad for some time. I'm outpatient. I don't physically go into the hospital, but several of my friends and loved ones and colleagues go into the hospital. And so Michigan has been very, very, very bad for quite some time now. But curiously, the further north you go in Michigan, so Michigan's like the hand and you got the thumb, right? So the further north you go, the less mask wearing it is, which is it's also more red as you go.
I was going to say, so the Upper
Michigan.
Peninsula tends to be a little more red when we think about the state of
Right,
Michigan.
but not even the Upper Peninsula. Once you leave the Metro Detroit area, Ann Arbor, University of Michigan, Metro Detroit, and before you even get to that UP, the further north you go, the less and less I see people believing in COVID, the more red it is, and the less mask you see.
That is frightening. Dr. Eric, what are you saying?
Yes. So it looks, knock on wood, but I think we might have peaked in New Jersey. These are often famous last year. I don't want to, jinx it or anything. These have been famous last words repeatedly, but for the fourth day in a row, we've been seeing steep declines. And it's thought that the peak may have been on the 11th. So the 7th-day average for new cases was close to 20,000. It was more than 19,000. And we're at about 9,000 as of yesterday. And hospitalizations are decreasing. Now, our hospital is full of COVID. If you look at your census, anybody that's got COVID has a little red C next to them. And for a while, you'd only see a few of them here and there. Now it's like around half the entire hospital census, or sometimes maybe 30-40%. But so it's not good right now, but it's nothing like the first wave. Fortunately for the majority of people, I happen to be lucky enough to live in a state that had a really aggressive vaccine program, and we have just a lot of community seroprevalence and pretty good measures. We have a pretty decent governor, and so we peaked pretty hard. It's not great right now, but I do think the path forward is good. I think we're hopefully going to continue to see these declines. I could be wrong. I hope I'm right. But yeah, the last month was tough. We definitely started seeing the hospitals filling up a bit, and when you go into work and you have to go around on a decent number of COVID-19 patients, that makes for a tough day. And those days definitely wear on you. And so I don't know how much more of this the healthcare workers of this country can take as far as additional waves. And so I'm really happy to see that at least in my state we do seem to be on a decline. That is not the case everywhere, though.
Well, I have a question, if I can interject here, Jason, if you don't mind, unless you want to follow up.
No.
My position with this is that I am looking at the imagery and the messaging that is coming from the political and the social establishment and the medical establishment in this country. And my position on this whole COVID phenomenon is that I'm pretty furious. And I'm furious because something that is supposed to be a health crisis, allegedly, in terms of how it's perceived, is being absolutely politicized by both sides of the aisle. And the people who got elected in 2020, who were literally largely elected because they were believed to be the best stewards of the COVID dilemma in the face of the failure of the Trump administration, have engaged in so many debacles in terms of messaging and procedures, from the point where you now have the Vice President Kamala Harris being asked a direct question about COVID testing, and she's telling people to quote unquote Google it. To the point where the CDC was at one time adamant about saying that you have to at least quarantine yourself for 2 weeks. And now they're saying, at the behest of corporate forces in the airline industry, 5 days is enough. At a point where we were being told by everyone that the vaccines will protect you, the vaccines will save you, the vaccines will do everything. And then the CEO of Pfizer comes out and says, not only will the 2 shots of Pfizer not protect you from Omicron, you probably may have to get a 3rd shot. And in Israel, they're having people get 4 shots.
Which didn't protect you from COVID, which did not prove to be successful in protecting you from an Omicron infection.
And I have plenty of. We had to cancel 2 guests who were vaxxed and boosted because they had COVID,
and they actually got ill. But what were you saying about the 4 Dr.
So Israel did do a 4th shot, but I believe it was yesterday or just a couple of days ago, they published that in the people they gave the 4th shot to, it did not decrease the likelihood of getting Omicron. However, 3 shots and 4, but 3 are still effective at preventing severe COVID that results in hospitalizations and deaths. So even though the 4th shot increased your total antibodies, it did not stop you from getting Omicron because it's so contagious. But it didn't really help prevent hospitalizations and death any more than 3 did. So we really do need 3. And I share your frustration. I'm pissed.
There's one more thing. This is one thing that really scared me.
Okay.
Because at first I thought it was a conspiracy theory. There was an actual legitimate medical report that increased boosters diminish your immune system. And I was like, hold on, what? How was that possible?
Was one of the doctors want to weigh in on that?
So here's the thing. The fact that we needed 3 shots to decrease the likelihood of death and hospitalization from COVID is not shocking. Just pull your kid's vaccination report from when they're a kid. There are multiple doses of vaccines that we have needed. 3 shots for hepatitis B. You need a tetanus every 7 to 10 years. If you look at their vaccination schedule, there are numerous shots that your children get that they need 3 total in their lifetime. And most kids have gotten these 3 or more shots, hepatitis B, Tdap, et cetera, and their immune system has not been weakened or compromised from it. However, as far as boosters moving forward, we do need to follow the science, and the science can't just come from Pfizer and Moderna, the makers of the vaccine. We cannot just blindly follow what they say. We have to prove, just like with Israel, they gave the 4th shot, but they did not prove that the 4th shot protected you from getting Omicron. Now, mind you, if you got it and you had 3 or 4 shots, it was much, much milder than if you didn't have any shots. But there is no reason to believe that if a vaccination schedule includes 3 shots, that your immune system is actually going to be less effective and weakened, because that would be the case for most vaccinated children who need a series of 3 shots of hepatitis B, Tdap, et cetera, et cetera.
Yeah. Yes. Yeah. I mean, if you listen to a lot of immunologists from the very get-go, the expectation was that this was likely going to be a 3-series situation. And then the question is, would that be enough going forward, or would this need to happen annually? And there's really no way that anybody could really predict that. I think the biggest problem is how hyper-concentrated vaccine efforts have been in wealthier countries, and how lower middle income countries were kind of left by the wayside, how, the forces that the powers that be really favored patent protections and everything that happened with the TRIPS waiver, and not making sure that we adequately and promptly got lower middle income countries vaccinated. And this is something I spoke about when I was interviewed back in maybe like August or September. This is going to come back to bite us in the ass, because the more this virus mutates, the more chance you get for mutations, and the more likelihood that one will be a variant of concern that can escape vaccines. And we saw, in fact, that the first major one of concern, Delta, came from India, which is a place that at the time did not, in I think maybe vaccine uptake somewhere in the single-digit percentage at the time. And now the newest one, Omicron, ostensibly came from the African continent. And the fact that we're not treating this as sort of a global crisis, and the idea that if we're not protected everywhere, then we're not protected anywhere, and the idea that we can keep boosting our way in high-income countries is just it's very clear that without the proper efforts to get the world vaccinated, we're not going to get out of this. And what I am very optimistic about is the Corbavax vaccine, which was developed at Baylor or Texas Children's Hospital, which is actually being released with no patent, no strings attached, and there are plans to upscale it specifically to India, and then the other lower and middle income countries are to follow. And the data so far suggests that the efficacy is comparable to the mRNA vaccines. It's even possible that some people in higher income countries that are a little more skeptical of some of the newer vaccine platforms or vectors, who might be a little bit more comfortable with a more traditional sort of recombinant vaccine, we might be able to improve vaccine uptake even in higher income countries with this, except there's really no mechanism to scale it up, because our regulatory systems were built for the sort of major corporate, pharmaceutical and biological products. And so there, we don't even necessarily have a pathway to get it approved in a country like the US. But I am optimistic that countries that so far have had trouble may benefit from this new one developed at Texas Children. And then there's a couple other ones like Novavax, which, I don't know how available that one's going to be, but another highly effective vaccine that's been approved by the EMA over in Europe. And I do think the path forward, I have optimism in some respects, but pessimism, because just whether it's the Republicans or Democrats or whichever political party, the approach has been a neoliberal one. It's been one that has really favored and prioritized the priorities of corporate America and pharmaceutical industry, and not of global well-being. And I don't really see any signs that this is changing. I don't see much more. I saw a really good meme where it was like basically like, Republican administration not believing in science, and they're stepping on a rake. And then you have like, here's the Democrats, we believe in science, we believe in COVID, but then they step on a rake anyway, because they still believe in that capitalism is going to get us out of this. And so they end up stepping on the rake anyway. And I thought that really, perfectly summed up the predicament that we're in on this. Well,
I want to make one last point, and I want to pivot to Jason. Jason, like, you can take over. There's one thing, by the way, I'm not trying to take a position on telling people what to do or what not. Listen, I have a senior citizen mother. I'm trying to protect her. I have people in my family that are overweight. Some people are diabetic. Some people have high cholesterol. Listen, I don't play games when it comes to this COVID. I really don't. If you ask Jason, when I talk about COVID, it's not a joke to me.
It isn't.
It's not a joke to me. And I found something very disturbing when I saw that video of the CEO of Pfizer just cavalierly saying, "Oh no, the two shots." And he had accent, "Oh, the two shots is not going to be enough. You will probably need a third, and hey, you may need another." And then I have a friend of mine, a good friend of mine, who's a doctor, and he's always trying to talk me off the ledge with the COVID stuff. Always. And his name is Dr. Phil. I'm not going to say his last name. I'm like, "Phil, what's going on here, man? This is pissing me off." He's like, "No, calm down, blah, blah, blah." And he explains it, right? And then when I sent him the video of the CEO of Pfizer making these statements, he was like, "Bro, these cats are just trying to make money." And then another friend of mine who is she's not very friendly to the mandates, to the precautions, and she's like totally like, "This is bullshit," sent me an article to tell me how much profit Pfizer and Moderna have been making from these vaccines. And it was estimated that Pfizer and Moderna were making $65,000 per minute.
But why is that? Why is that surprising with capitalism? That's what capitalism does. The fact that the Pfizer CEO is saying, hey, we might need 100 shots, that's what he's going to do. If you listen to the science is very clear. If you have 3 shots, the 2-shot series and the booster, you are much, much less likely to die or be hospitalized from COVID. That's a fact. That has nothing to do with Pfizer. Now, whether or not we're ever going to need a 4th shot remains to be seen. The most recent data out of Israel says a 4th shot will not protect against Omicron cases. So if somebody says, hey, let's get this 4th shot to cut down cases, to date, there is no proof that that is the case. However, we're learning about this thing as it goes. 2 things can be true. Big Pharma can be horrible. Their ultimate goal could be a financial profit. And 3 doses of the COVID vaccine can be life-saving. Both of those things can be true. There's no disagreement. So the fact that the Pfizer CEO ultimately wants to make money, but their product is a good product, those 2 things are not in disagreement. That's the way for everything in this country.
Well, let me ask.
Purchase. Somebody makes a product. If you purchase a good and you're happy with it, somebody made a profit. The fact that they make this huge profit in the middle of a pandemic does not mean you need to be extra suspicious of the product when we have a ton of data that shows that it's still a good product.
Dr. Dooley, let me ask a question I want to ask you. What's to stop the Pfizer company from incentivizing creating boosters or vaccines that aren't maximizing effectiveness under the argument that we want them to get more boosters?
But you're acting like Pfizer and Moderna are not being checked. Like I said, we have this study out of Israel that said we gave people the 4th dose and it's not working. So if somebody came out and said in the US, hey, everybody needs a 4th shot now, I'm telling my patients the data does not support that. Let's wait and see. You're saying you're acting like the whole world is just listening to Pfizer and Moderna. There's no scientists. There's no checks and balance system. There is.
Right.
So we're going to continue to follow the data and listen. So yeah, Pfizer can come out and say, y'all need 101 shots. Y'all need a shot every 4 months. But that doesn't mean that all doctors are going to fall in line and start recommending that.
But before
the data doesn't support that.
Before I ask the super chat question, I do want to ask this question to the entire panel. Do you think, because the narrative gets spun that is somewhat intellectually disingenuous about profit motive, negating the effectiveness of the vaccines, right? I think that's what we're getting at here, that once we say that there's a profit motive, then all of a sudden these companies turn into Dr. Evil and it's a comic book and it's good versus evil, instead of it seems to be just a function of the system. But these vaccines have been proven to be effective. How should these stories be reported so we keep from having, I don't want to say conspiracy theory, but vaccine hesitancy, let's say?
I think we can never get rid of vaccine hesitancy. And unfortunately, because we don't have universal health care that's free at the point of care, everybody doesn't have a doctor that they know and trust. But ultimately, there are people in the field who are doing their research separate from Pfizer and Moderna, and they're putting out, like I said, this was an article I just saw, it popped up on my phone about how the 4th dose in Israel was not decreasing Omicron cases. But I share the frustration with the CDC, as do most healthcare professionals, decreasing the isolation period from 10 days to 5 days simply because the Delta CEO wanted it. And then there's this confusion about they didn't have people retest to get out of isolation. And so what are people, but you can test if you want to, but we're not recommending you test. I have an example. I have a young lady, she got COVID on January 1st, didn't call me. Got retested on January 10th with a PCR test. PCR test can be positive for 3 months. They amplify.
What is a PCR test?
There's a rapid test that we're talking about that's getting mailed to our house and that we buy. The PCR test is a test that usually gets sent out to a lab. Some places can do it within hours, but other places it might take days to get your results. So it's a more accurate test. But what the PCR test does is if you had COVID 10 days ago and are no longer infectious, but there's some dead COVID particles still left in your respiratory tract, the PCR test is going to amplify that dead COVID virus that's not infectious and come out as positive. That could go on for 3 months. So she thought that she needed to test to get out of that quarantine. So she got another test, but instead of doing a rapid, she did a PCR test, which, like I said, could be positive for 3 months. So then she wanted a letter from me stating that she was supposed to stay out another 10 days because her PCR test was positive, even though she had no symptoms. I don't blame her. I blame the CDC for their garbage guidelines, for them not being clear, and for them confusing people. This is the CDC's fault. The 10 days was fine. If they wanted to change it because the evidence said most people aren't infectious after 5 days or 7 days or whatever, they should have made it very clear that you should test to get out of quarantine, and that should be a rapid test, not a PCR test that can stay positive for 90 days. They didn't do that. And you're right. When they first came out with this vaccine, we believed, oh, we're going to get vaccinated. Anybody who got the vaccine is not going to get COVID, is not going to spread COVID. We didn't know that for a fact, but that's what we were told, and that's what our hope was. And that messaging was wrong. So I get people's frustration. I get it. But to say that something is inherently bad because somebody's making a profit, that's only a half truth. You can have a good product and you can have somebody who's profiteering off of it, charging too much, and ultimately just want you to buy more of it because they have a profit reason for you to do so. But it can still be a good, useful product, a life-saving product. Look at anybody who's had chemo or surgery. If you had a heart surgery, some of these medical devices cost tens of thousands of dollars. So yes, ultimately, when the medical device guy goes to the cardiologist's office and talks about his device, ultimately, they just want the money. But that doesn't change the fact that that device saves lives.
Yeah.
Dr. Dooley, by the way, I respect eminently your expertise here. And my point is not to be a naysayer on the need to take precaution of whatever type. That's not my position here. I am simply saying, as someone who is not in the tinfoil hat realm, but as someone who has seen the political establishment and the medical establishment drop the ball dozens of times with this messaging. I at one time was very angry at the people who were doing the right wing, COVID is a joke. It's a conspiracy, blah, blah, blah. And I was like, oh, this is, I know people, all of us know people who've died from COVID. All of us do. But what I'm saying, what's frustrating me is that we have an administration that came to power largely under the auspices of being a
I agree with that frustration, but what do we do now? That doesn't change the fact that it increases the likelihood of us dying from this illness that our government is not helping us from. Our best chance is to get 3 vaccines. I share your frustration with this administration. You go to my Twitter feed, I am not at all happy with this administration. I saw it coming. I wasn't as hopeful as some of my older elders who are really optimistic about this administration. So I agree that this administration dropped the ball. Therefore, but what are we going to do to decrease our likelihood of dying with COVID? And what are we going to do to move forward to live with this is what I'm saying. Yes, I'm angry. I'm mad. This administration dropped the ball. The CDC dropped the ball. The vaccine manufacturers dropped the ball, misled and lied. However, we are where we are now. So we still have to do what we need to do to protect ourselves.
Well, one of the big obstacles I see on my end, and you guys can tell me about how you see it on your end, is the failure of institutions. Because of the CDC changing guidelines constantly, even we have to go back to the failures of the Trump administration. As we can point as many fingers as one as the current Biden administration, definitely is problematic. This all really gets effed up under Trump and his CDC reign, and some of the mistakes CDC made with testing up front. If you remember, the tests were bad that we had. How do we regain that trust? Because I'm sure you guys have to deal with it on your end, with people not even trusting doctors. And I think that was a very, very interesting point that you bring up, Dr. Dooley, that people don't have regular medical professionals that they can't trust. How do we try, from just the level of from doctor to patient, how do we begin to build that trust? Eric, how do you do that with what you do?
I mean, we need universal healthcare. We need free at the point of service healthcare. We need we need patients to be connected to doctors that they trust, with whom they have longitudinal relationships, and that has to be decoupled from people's finances. In other words, it has to be covered universally. The only plan I've seen put forward that has a prayer of doing that is the single payer system. Now, there are countries globally that have non-single payer systems that have achieved this. I just haven't seen anybody put any one on the table that looks reasonable. I've had people come to me, through my telehealth service. They found my name from this interview or that interview or from a website or whatever, and they're confused. They don't know what to do. They're consuming all kinds of content online, whether they're watching, McCullough on Joe Rogan, or they're confused by what they're seeing on CNN, or they're on Fox News. They're not bad people. They want to make the right decision for themselves and their loved ones. They're confused. They're consuming a lot of content they don't know what to do with. And what they need is someone they trust to hold their hand through the decision. And I've had so many people come to me who have been unvaccinated so far into the pandemic. In some cases, I've had people who started the meeting with, "There's no way I'm getting this." And by the end of a 20-minute conversation with me, by hearing someone, for whatever reason, they trust me, they followed me on social media, they've heard me speak, or we've met, they trust me for whatever reason that is, and they hear me tell them, "This is what you need to do." Hearing it from a trusted healthcare professional makes a difference. And these people will send me texts and emails saying, "Hey, I got it." Or they'll take a little screenshot of their vaccine card. "Thank you so much for guiding me through this decision. However, this is a luxury and a privilege for some and not a right for all." So first and foremost, we need that. We need a system that decouples medically necessary interventions like vaccines from profiteering, because the more profiteering there is, the less trust there is, and that's bipartisan. You could be on the left or the right and feel that way. And that's why I think all these efforts to protect patents and to protect profiteering and to propagate this myth that we can still get all the equitable allocation with that approach, I mean, it has been a myth, and I think it's been terribly destructive. When I've come on your show in the past, I talked about the GHSI, the Global Health Security Index, and how the United States was poised overall with a very high score as far as the ability, resources, and infrastructure to tackle a pandemic effectively. But the one aspect on that test or on that index where we scored poorly was public trust in institutions. And the inconsistencies and the poor communication through both administrations have compounded this, and they have created a lot of rifts. They've created a lot of distrust, and this has been extremely harmful. And then, of course, going back to originally what we actually were seeing, the vaccines not only preventing death and hospitalization, they were very effectively preventing spread. But what happened? We didn't vaccinate the globe. We left massive swath of the globe unprotected, which allowed this thing to keep mutating and mutating, and we wound up with variants of concern that turned out to some degree, find vaccine evasiveness. And now here we are with this Omicron variant, and now we already have subvariants of that. And until we find ways around the capitalist forces that have guided and sort of governed healthcare policy and allocation, we're going to be in a lot of trouble. And I think if to bring it back to this idea of, can this somehow be used as a catalyst to maybe drive up more political will to get that policy? I mean, maybe that's something Dr. Dooley has been much more of sort of an activist for Medicare for All than I have, and has been on campaign trails and been in more of the political side of it. Maybe Dr. Dooley can weigh in a little bit more on that aspect of it.
And I want to appreciate both of you, Eric and Dr. Dooley as well. And if I come off as being antagonistic to the best advice of medical professionals, that's not my goal at all. It's just that I've seen the frustration in my own household, in my own family. I've seen people's lives risked, and that's not. There's nothing special about me in that way. All of us have seen the same thing. But I'm glad you guys.
Well, let's be honest. This is a frustrating situation where you have you've made it.
This is my thing as a black doctor. Studies. This is not a racist statement. Evidence studies have shown that patients of color, black patients, usually have better health outcomes when they have a provider that looks like them. And a lot of that might boil down to trust. They're more likely to trust somebody who looks like them. So this is my ministry. I'm burnt out. I'm in a position, I don't have to work. I go to work because this is my ministry. This is what I'm doing. And this is what I'm doing for everybody, but especially for people like this. So when people, two things can be true. Somebody can have a profit motive and be bad, but can have a good product. These two things can be true. They are not in disagreement with each other because we live in a capitalistic society. So I am very effective at convincing my patients to get vaccines, not just the COVID vaccine. Before COVID, my medical assistant, she's white. She'd room somebody. She said, I asked them if they wanted to get the vaccine. They said, no, you're probably going to get them to change their mind. Because she knew that I had a way with my patients who trust me. If you don't trust me, go find another provider. I'm not trying to be the richest doctor in the world. So you need a doctor that you trust. You don't trust me, don't come to me. That's what everybody should do. If you don't trust your doctor, unfortunately, people live in rural areas, they might not have the option, but if you live in a big suburb where there's a doctor in every quarter, find another one immediately. So this is my ministry. I sit down, I talk to them, I find out why. And when they tell me why, I don't, belittle them or make them feel like the reasons why they don't want to get a vaccine are insignificant. Let me give you an example. Some people believe the flu vaccine causes the flu. I say, look, Mr. or Mrs. Such and such, some things are just scientifically impossible. Just not scientifically possible for it to happen. I said, there's no live flu, influenza in the flu vaccine. If you do a nasal flu vaccine, that has some live flu in it. So people who are immunocompromised shouldn't get a nasal vaccine, but there's no live flu in the vaccine. It cannot give you the flu. It's scientifically impossible. But here's the thing. When do we give people the flu vaccine? We give people the flu vaccine during flu season. So everybody's getting the flu and we're trying to give you the vaccine. How long does it take the vaccine to work? It never is 100% effective, but it takes about 2 weeks for it to kick in at all, okay? So you're at work, your coworkers has the sniffles, then they tell you they have a flu. You're like, oh crap, it's time to get my flu vaccine. You run to me, I give you the flu vaccine. You get the flu 2 days later. It is not because of the vaccine. It is in spite of the vaccine. And I remember the year it happened to me because I have to get the flu vaccine every year, 2009. I got the flu a day or two after I got the flu vaccine, but I'm around people who have the flu every day because I'm a medical provider, but because I knew science. I didn't say, well, I'm never going to get the flu vaccine again because it gave me the flu. I can't as a healthcare provider. I had to get it. So when I explain this to them, and I'm like, look, some things are just not possible. When I sit down, I take the time to have this conversation and explain it to them. Oh, they get it. But nobody has taken the time to explain that to them in this way. They read somebody's blog who's not an MD, don't understand the science, whatever. And from their personal experience, I said association is not cause. If you drank a Dr. Pepper, went outside, got hit by a semi-truck, are you going to say, oh my goodness, that Dr. Pepper caused me to get hit by that semi-truck? No, it's the same way that the flu vaccine is not going to give you the flu. Association does not equal cause. A day or two before the vaccine even kicked in. So when you sit down and talk to people like this who know and trust you and come to you because they know and trust you, not all the time, but most of the time, they are willing to listen. So this is my ministry. I do this because a lot of times providers don't have these conversations with any patients. But when you look at healthcare disparities, Black people are more likely to die from almost every illness, even illnesses that we get less. Black women are a little bit less likely than white women to get breast cancer, but more likely to die from it. So when I see this, that my people who look like me, are disproportionately dying, I take the time to establish a rapport with them and educate them. And I say, I'm telling you this because I love you. If another doctor didn't tell this to you, I know they know it. It's probably because they're overworked, they don't have time, or they don't care, they don't love you like I do. I don't want you to be another statistic. So you have to establish a rapport with your patients. And because it costs money to come see me, I understand why some people are sick and they don't call me and don't come see me. Even though I'm very generous with my patients, we accept Medicaid, we do charity care. It costs a lot of money to go to the doctor. So I'm not even able to do my ministry as much as I want to. That's why I'm always online sharing tips and stuff, even though I've always got to put the disclaimer. Check with your doctor when I know most people don't have a doctor. So we really do need a system where anybody who wants a doctor can have a doctor. If they're not happy with their doctor, they can go find another one without it being a financial burden for them. Not only that, tuition needs to be free. College tuition needs to be free. I went to all public schools. I didn't go to Harvard, Yale, Princeton. I don't feel bad about it. I went where I wanted to be close to my family, where I felt happy and comfortable. Why should I have about $500,000 in debt? Because I did that. So now, if I'm looking for a job and I was somebody who was from the inner city or from a rural area, and I want to return to that area and practice, but I have this huge, I'm fresh out of school, I got $500,000 of debt, and the rural or the inner city community is going to pay me pennies on the dollar compared to what the big suburban practice is going to pay me. Where do you think I'm going to go? I'm going to go to the place that pays me the most because I got all these loans to pay off. But did you know the people are more likely to practice in rural and inner city areas if they grew up there? So if you want me to go back home to practice, you need to make it affordable. So when I talk about Medicare for all, yes, I'm talking about a single payer Medicare for all system where you can go to the doctor and not pay anything out of the pocket. But I'm also talking about we need education to be free so that when people want to go into medicine for the right reasons, they can. Because I have a ton of people who wanted to be a doctor, but when they realized how much student loan debt it was going to cost them, they changed fields because they knew it's just not going to be an economically viable solution for them.
Well, Dr. Dooley, I'm really glad and honored to have you on the show because I wanted to focus some of my questions on you as a Black woman who was a doctor, who was a Bernie Sanders surrogate, and understanding how Bernie Sanders and his policies were painted in the eyes of elements of the Black community as quote unquote not being sensitive enough to Black issues, and how you, as someone who was a Bernie surrogate and a doctor, particularly with his plans for universal health care, navigated that terrain. And I also want to ask, why are we on the left so bad at taking this opportunity to be evangelists in the ministry for universal health care?
I don't know. I don't know if we're bad at it. I think it's just something that people get frustrated and bitch about online, and the movement for it from a civilian standpoint becomes really online. There's definitely people in the medical field that are fighting extremely hard for it. I also think a lot of people don't see the real effects of it. Working with the unhoused, nobody really cares about the medical condition that these people are in. I'm not just talking mentally, I'm talking physically. I don't know if I've said this before on the show. I was talking with a lady friend of mine, and her daughter works at, it's called a SNF. I forget exactly what it stands for, but it's kind of like a facility for
skilled nursing facility.
Yeah. And they're dealing with people that have been kind of booted out of hospitals or emergency rooms, a lot of older unhoused people. And I guess there is a COVID outbreak. And right now she's like one of the few people that doesn't have it. And they don't know how many patients they're dealing with that actually have it. And when I was working at the shelter, the emergency shelter in Oakland, we had nurses that came from the prison system that literally walked out after the first day. Mm-hmm. Literally, they're like, I've never seen anything like this. This is insane. And they left. So for me, it's a necessity because we are only as protected as the most vulnerable of us. And as we constantly throw humans away, especially in my great state of California, Skid Row is a frightening place. Where I left in Oakland, by where I lived on Wood Street, was a frightening place when it came to the lack of access people have to healthcare. You're lucky if you get a good Samaritan coming by with some clean needles, and maybe they'll do a quick checkup on you.
Well, I wanted to address something that's coming up in the chat, saying a lot of people want to go into medicine because it's a prestigious job and they make a lot of money. Let me tell you, there's a lot easier ways to make money, to make six figures. You can be a truck driver, UPS driver. You can be that at 21, 22, have zero student debt. You can start making six figures while I'm going to medical school and residency, spending all these times. I got a decade where I made no money, basically, or pennies, because I'm in medical school and training. There's a lot of easier ways, especially be a Instagram star or TikToker, one of those type of. There's a lot of easier ways nowadays to make money than to devote 13, 18, I'm like 30 something years old by the time I'm making any money. So there's a lot of easier ways to make money. And the reason why a lot of rich kids go into medicine is because that's the only people who can afford it in the United States. Like, we're talking about hundreds of thousands of dollars of student debt. We can get more people in medicine who are going into it for the right reason if we make public university and colleges tuition free for the public, just like the public library is free for the public. So we can get more people in medicine for the right reason if college is free. But it's a misnomer. It's not a fact that people go into medicine because they want to make a lot of money, especially in this day and age. Go into computers, like I said, be a TikTok star, be a gamer. There's a lot of easier ways to make six figures than to devote your life to medical school, even if you're smart, just because it's so much time out of your life.
Yeah.
But if you can you talk about your experience as I'd like to, if we can get to that briefly. I know we're going to go into the Patreon section if you guys can go there, but I'd like to talk about your experience and motivation for affiliating yourself with the Sanders administration.
You know what I like, Bernie just made sense. First of all, Medicare for all. And you look at, it's just common sense stuff. College should be tuition free. If you don't have a house, you should have a house. Housing for all. It's just basic solutions to problems. If you went up to a 6-year-old and you said, you were interviewing him, you said, you know what? In this country, we have millions of people who are uninsured. What can we do to solve this problem? This dude's 6. Well, I don't know. Just give insurance to everybody. It is literally that simple. And when you looked at Bernie's policy, he wasn't just saying, let's just give everybody health care, but he's saying, let's give people health care. Let's give people debt-free college. Let's give people who don't have a home. Let's take care of the climate injustices, how fracking is disproportionately done in Black and brown neighborhoods. All of his policies just came together because when you talk about health, you cannot talk about health without talking about the social determinants of health. That means, do you have a house? Do you have a job? Are you affording your food? Are you food secure? You cannot be a healthy individual if you are houseless. You cannot be a healthy individual if you can't afford healthy food, if you live in a food desert. So his policies were comprehensive. He wasn't just trying to put a Band-Aid on the solution. And because African Americans are disproportionately affected by things like fracking, things like college debt, because Black women are the most degreed women, and we also hold the most student debt. And when we do get those college degrees and get a job, we get 60-something cents on the dollar compared to a white male for the same job. So even though Bernie's policies included everybody, because Black people are disproportionately affected, they're disproportionately houseless, they're disproportionately in more student debt, his policies that included everyone are going to help Black and brown people even more because we have more to gain. So that's why I got behind Brother Bernie, because it wasn't just Medicare for all. That's what people, Medicare for all. As I started looking more about his policies, how are we going to achieve Medicare for all if people who are in rural areas, people who are Black and brown, need doctors who look like them, but you are looking at $300,000, $400,000, $500,000 a day? He had a solution for that. How are we going to take care of people's health when there are people in this country who are houseless? He had a housing for all policy. How are we going to make sure that people are healthy? If they're Black and brown, they're disproportionately, people are fracking disproportionately in their neighborhoods because they don't frack in rich white neighborhoods. They frack where Black, Latino, and Black people live. So his policies just all fit together to address all these social determinants of health. That's why I was so passionate about Brother Bernie. And what I loved about his campaign, traveling to places like Iowa, New Hampshire, places I had never been before. I had never seen a cotton field in my life. Never. I mean, I knew there was cotton fields. I knew about slavery, but I'm a northern girl. Michigan, Ohio. I'd never seen a cotton field in real life. Going somewhere and seeing a cotton field, a hospital was right next to a cotton field. Oh my God. I had never seen anything like that in my life. So traveling the country and sitting down with people who didn't really like Bernie because the media didn't give him a fair shot, because the brother had good ideas that were transformative for the whole entire nation. And he, capitalism wouldn't win as much under him. So that's why Bernie didn't get press. So when I sat down with these people and talked to them about Bernie's policies, they did seem too good to be true, because we're not used to a government who works for us. We are used to a government who only works for the top 0.1%. But when I talked to them about his policies and how those policies would disproportionately benefit us, then I got a lot of people on board for Bernie who did not like it, considered his name to be like a 5-letter word before I sat down and talked to him about it. it was easier for me to get the younger people on board than it was the older people. Because again, it sounds too good to be true. But look to the north, Canada, they have universal health care. They're paying, less for insulin than we are. It is good things are possible, but we are trained to believe that they're not in this country. So Bernie's policies, by including everyone, college for all, you're going to make sure nobody is left behind, because these means testing policies, they're garbage. Like this whole cancel student debt. Oh, it's going to disproportionately benefit rich people. Rich people don't have student loan debt. And if you're helping millions and millions of low income or middle class people, let's say one or two rich people fall through the cracks and you cancel their student debt, so what? We bailed out Wall Street, but we can't bail out all Black women who are underpaid, who have student debt. And people don't like this when I tell them this. Student debt is cancel student debt is a racial justice issue. If you are a white male and I'm a Black woman, we work the exact same job. I'm getting paid 63 cents on the dollar compared to you, just because I'm a Black woman. So if you're a white male, you're getting $1 for your work, $1 out of $1 instead of 60-something cents on your dollar. You can put 25 cents of every dollar you make towards your student loan debt. You got 75 cents now. I still got 67 cents. So it's easier for you to pay off your debt just simply being a white man, because you get paid more money than me. That's why it's a racial justice issue. And by including everyone, you're going to make sure nobody's left behind. When you look at Obamacare, when you look at expanding Medicaid, every action that our politicians take to ensure more people, there is still every single time a disproportionate amount of poor people of all colors, Black, Indigenous, brown people left behind. So how do we ensure that no Black, brown, Indigenous, poor person is left behind? We give insurance to everybody. He was the only politician who was not mean testing. So that's why I got behind Brother Bernie, because by including everyone, nobody who looks like me is going to be left behind. And that's the way it should be.
So, we're coming down to an hour, and I have my theories my understanding as to why was the media establishment and its cohorts of color, the Black chattering class, as I call them, and the Black political class, so effective at painting this image that Bernie doesn't care about racism. Bernie is insensitive to the issue of race. Bernie is a class reductionist. Why did that work so effectively, in your opinion?
I feel like it worked effectively towards our older Black generation who is not used to getting anything. They just accept. I give an example. My parents, I love my mom and dad. They're the best people in the world. I am who I am today because of them. But they think because Biden is, giving these 4 tests per household, they're happy. Ooh, I think it's insufficient, too little, too late. But they're like, ooh, no, but no other president has sent, some free in their lifetime, sent something free to their house. So they're really excited. They're older. But Bernie posed very well with young Black people who we can't go to college and pay. What did our parents and grandparents pay? $5,000. We can't go get a factory job and buy a house. So we expect more because times are harder for us. And why was the media so effective? They were super effective at older Black women, older Black males and females, because I went to a lot of churches. But I'm going to tell you, I was at this church, and I'm a preacher's daughter, okay? I'm a preacher's daughter. I know the Bible. But I was at this church, and I'm going to be honest, I didn't want to go because I knew it was going to be a lot of older Black people who I was going to have a hard time getting through to. Because they're like, well, Joe Biden, he's friends with Obama, so he's good enough for me. And that's their whole answer. Joe Biden, Obama, I'm going to vote for Joe Biden. So I didn't want to go. So I went up, and, little Kamala and the Joe delegate, they did their little spiel or whatever, how they're going to do this, that, or the other, how they're going to help more Black people. And I was like, well, Bernie's going to have all Black people. It ain't going to be, we're going to help some. He's going to, make all HBCUs, public college and university trade school free. But that's going to be no Black person left behind. So I gave my little spiel. It was a good spiel. I know it was. I was tight. I was a good speaker. I was an excellent surrogate. Anyway, so I'm proud of myself. And then we have the little time at church where we're supposed to go shake the hands. And so this older Black lady on a walker comes up to me and says, hi, did you know that your candidate is, I forgot, a communist or something, she said, and he's really a plant for Russia? And I'm like, oh my God, Jesus help me. I'm in the church. Jesus help me. So I'm upset and I'm frustrated. I'm like, look, I came up here. I know I did a better job than the Biden and the Harris delegate. I know I knocked it out the park. This old Black lady came and here I am. I'm not getting paid to be a surrogate. I took time away from my family, my practice to come and do this because I believed in these policies. So I'm like frustrated. I'm in church. I'm crying. I'm like, I didn't even want to come to this church. This young Black man, but when I say young, he must have been in his 40s. He comes up to me and he says, sister, don't cry. He said, you are doing the Lord's work. He said, people like MLK Jr. are looking down, smiling at you. And he said, I saw that woman come up and say what she said to you, and know that not all of us believe that.
Steve says you should have rebuked her name in the name of Jesus.
She was on a walker. From choking her. Like, lady, what are you talking about? What are these words that are coming out of you? You're just spewing some nonsense that you heard, I don't know, on Fox News or what, something that makes no sense. But they attacked Bernie because they knew that, you know, he was going to tax billionaires.
There's an attack, and I want to lead into the bonus champagne room with this. There is an attack going on coming from the Black political class as well. And we saw one of the first strikes that for this election cycle, I should say, with the mayor of San Francisco, London Breed, who faces a bit of a challenge from white progressives to her left. London Breed has a DA in San Francisco that admits to being a socialist. He's literally the son of people in the Weather Underground. He's only known his father behind prison bars for blowing up a bank or federal building. I forgot what his dad blew up. But Chesa Boudin is getting facing a recall, and it is nice to get DAs in office that say things like, yeah, I really am getting rid of cash bail. I actually am prosecuting police officers that beat up and kill people. I'm throwing people out of the office that ignore these cases or facilitate police with the ability to beat up people. And also there's a few socialists on the city council, and London Breed came out recently in an interview, I believe for the New York Times podcast, and said that because she is a Black woman, and she grew up a poor Black woman, she understands the plight of the poor Black people in her city, which there isn't many of. Most of them are homeless, and the white progressives to her left don't really look at things realistically and take an ideological approach to solving these problems. So we can dive into that as well, because I do think that is going to be a huge issue in coming up in this midterm election and moving forward in 2024. And also California might be the first state to have single payer healthcare. Will you be joining us, Eric, for the champagne room bonus half? Can we keep
I'm in.
longer? Dr. Dooley, keep you just a little bit longer?
A little bit.
Okay. So I'll send you guys the link. Pascal, do you have anything to say before I end this show?
I really enjoyed Dr. Dooley kneecapping me precipitously on the show. I mean, contrary to people have, man, I got no problem with a sister to give me, give me the backside to the hand when it needs to be done. I'm cool. I'm confident enough. I like it. It's all right.
Okay, good.
Pascal, I can't have you that happy that you're getting spanked. So on that note, we are out.